either access it through the NLADA webinar webpage, or you can access it through the NLADA's YouTube channel. So in this webinar, we are going to be highlighting SSVF partnerships and medical legal partnerships, which builds on the last webinar that we posted a few weeks ago, which gave an overview of the research showing legal aid works and the funding sources that can support your work. We have scheduled this webinar for 2 hours. That being said, I can't imagine it going more than an hour and a half. So moving along. So on the NLADA side, you have me, Casey Chapetta, and Radhika, and we will also be hearing from Jen Trott from the National Center for Medical Legal Partnerships, which is located at George Washington University, and Patrice Haldino, who is the Executive Director of Coast to Coast Legal Aid in Florida. You can access our contact information here, and I will also put a plug-in right now that if you would like individualized technical assistance, you can reach Radhika and I at resourcedesk@nlada.org. That email address is also on the last page of this webinar. And at any time, if you have questions, if you can't hear for any reason, you can go ahead and send us a chat message, and we can help walk you through, help you troubleshoot any of the audio issues that you're facing. Also, feel free to send questions throughout the webinar. We do have time slotted at the end of this webinar for a Q&A. That being said, if there's a bunch of questions about MLPs and we would like to address them after Jen speaks, we can do that then. Our speakers will speak for about 20 or 30 minutes, leaving time for a question and answer at the end. So this is part of a 3-part webinar series. I'm just going to provide a brief overview of what we talked about in the first one. You can access it through the link, and then I've also put all of the different URLs at the bottom of these pages. So if you can't do that, or you would rather type the address in, you can go ahead and do that. So in this webinar, we went into the research that shows legal aid works and provided overviews of various funding streams, SSVF, VETS, Grant Per Diem, and HUD-VASH that can support your work. We spoke about peer-reviewed studies that investigated the legal needs of veterans, as well as studies that showed legal aid is uniquely positioned to address them. The PowerPoint slides are on the NLADA webinar webpage, which you can access, and you can also access all of the links through there. I should note that during this webinar, we did have some technical difficulties. So if you are looking for this webinar and want to watch it, it will be re-recorded on September 30th and uploaded shortly thereafter. You can access it either on the NLADA's YouTube channel, or you can access it on the NLADA's webinar webpage. We also have an upcoming webinar on October 1st at 3 p.m. We will be speaking with Nan Heald from Pine Tree Legal Assistance, which runs Stateside Legal, which is an online tool that veterans can use to answer questions and find resources related to legal needs they're experiencing, benefits questions, etc. And then we will also hear from Sean Clark at the Department of Veterans Affairs on why screening is important and how to screen your clients for veterans. That will help you identify the needs in your communities and also help with later grant applications and partnership proposals. So diving into the meat of this panel presentation, I'm going to just provide a brief overview of medical legal partnerships, or MLPs, and why they relate to veterans. And I will pass it on over to Jen from the National Center for Medical Legal Partnerships, and she's going to talk about their new VA Readiness Guide. So the idea behind an MLP is that while a doctor can write a prescription for an inhaler, for example, a lawyer can treat the underlying problems, such as housing violations like mold and rats, which can make writing the prescription for the inhaler redundant. Biology, genes, and health behaviors are estimated to account for only 10 to 20% of the determinants of health, and access to medical care and social characteristics make the most difference, determining about 80 to 90% of health outcomes. These issues, such as housing, landlord-tenant issues, benefits, income maintenance, and domestic violence, are often the most typically addressed by MLPs because they are directly and clearly related to the social determinants of health and are often uniquely positioned to address them. So what can MLPs do? So the first study in here profiled 4 MLPs in Connecticut and New York who collectively served 950 veterans. They found that in both the short and long term, veterans showed improvements in mental health and housing. The second study comes from the National Center for Medical Legal Partnership, and this brief profiled various MLPs that served veterans. This study finds that MLPs are particularly good at recovering benefits, stabilizing housing, and increasing outcomes. These studies aren't just related to veterans. MLPs are proven to address the underlying social determinants of health across populations and are successful in doing so. They have been shown to improve health, reduce stress and healthcare costs, and improve children's access to food. Setting up an MLP with a special population focus, like veterans, can help narrow your focus to a population with a high number of unmet legal needs and a high demand for legal services. So here I've linked to a few resources where you can learn more about MLPs. The first 4 links take you to helpful briefs and pages with more information from the National Center. The National Center has various resources ranging from issue briefs on financing MLPs to case studies on certain partnerships. They also host webinars and send out bi-monthly updates. The last reference here is from the VA. This spreadsheet can help you identify partners in your area, examples of MLPs, and provide you with a starting point to reach out to different organizations and learn from their models if that's something you're interested in. So now I'm going to hand it on over to Jen from the National Center.
All right. Hi, everyone. Can you hear me all right? I'll ask Casey. Casey, can you hear me?
Yes, we can hear you.
Great. Perfect. So thank you for having me here today. And Casey, thank you for doing the hard work of the intro and laying the foundation here. I'm really excited to hear that there's a lot of energy around working with the veteran population. Specifically, for the past couple of years, the National Center has done a lot of work in that area. And I think for those of you that are looking to plug into a medical legal partnership, or maybe you have one and are looking to expand it, I think that there's a lot of opportunity to reach a number of people with legal needs in this community. So I'm going to try to advance. So I'll go the other way. Great. All right. So let me give you a little bit of background here because, as I mentioned, there's been a lot of interest, especially within the last 10 years. And in addition to the need that you've probably heard about through indicators like the challenge survey, some other reasons for recent growth among VA MLPs and legal clinics is this directive that the VA issued in 2011. And you might have heard about that directive in the last webinar, but real briefly, it encourages VA facilities, VA medical centers to make space available for legal services to come and provide help to veterans. And along with that, you probably heard about the supportive services for veterans family programs, and you're going to hear about that from the next presenter. That as well considers legal services as part of the key support that veterans with housing issues need to do better. And then following that, the VA National, their Office of General Counsel, a couple of years ago, established this internal task force. And that internal task force actually, that list that you saw that we linked to of VA-based legal clinics and medical legal partnerships, that is theirs. So they are really the eyes and ears of these programs across the country, and they've done a really great job keeping that community together, thinking through what technical assistance might be helpful to those organizations looking to set up a VA MLP, and they've been a great partner to us and the NLADA as well. And they will assist you if you're looking to start a VA MLP, and you'll have to actually go through them to set up your MOU process, which I can talk about in a second. And then I also wanted to mention that the now Deputy Secretary of VA, who was with the Office of General Counsel, Deputy Secretary Byrne, a couple of years ago set out this goal to make VA MLPs available in 100% of VA healthcare facilities. We have not gotten to 100%. We'd even be happy with getting to 90, but we're starting to make a dent in that. And I think just the commitment and setting that lofty goal is really exciting, and it's a really important indicator of VA support for these kinds of services. So there's actually another map out there from ARERA that shows these numbers across the country, and it's actually quite impressive, the spread, both in terms of legal clinics, which are a little less formal arrangements at these VA sites. Maybe they come once a month to work with veterans on specific legal issues. And then VA MLPs are spreading slowly but surely. And then also these partnerships with law school clinics as well. And I just want to make a pitch to you all today. So my job is really to look at these medical legal partnership models and their various adaptations. And I think that the veteran population is particularly attractive and great to work with for a couple of reasons. Number one, the support that comes from the top that I was talking about. There is a real interest at VA in making these services available to as many veterans as possible. And a few weeks ago, Secretary Wilkie of the VA had an op-ed in the Washington Examiner, and he was talking about the importance of partnerships and their role in the future of the VA. And he gave a shout out to legal services, which I think is really important. And then the other reason for lawyers looking to start an MLP or have a new partnership with a healthcare organization, you might know that it can be a little difficult going in and trying to figure out where you fit. For a lot of healthcare facilities, social determinants of health, that is a hot button issue now. There's a lot of energy around it, but a lot of places are just getting started. And in the VA, social determinants have been around for decades. They recognize that as going hand in hand with medical issues, and the role of the social worker and behavioral health and all those other individuals that add on to the physician, those are teams that are in place already. It's widely recognized. So if you're thinking about a partner that knows what value you're going to bring, and if you're looking for a team to plug into versus sort of building your case and winning over hearts and minds and building that from the ground up, I mean, the VA has done a lot of that work already, and they're looking for partners. I'll just mention here, the Bob Woodruff Foundation has been extremely supportive of making more legal services available to veterans. They've funded some of our work, and they held a convening earlier this year in DC. And that convening is important to mention because there are a few resources that came out of that. And one of the resources comes from the NLADA, our friends on the phone here, who are very knowledgeable about policy issues and sustainability when it comes to VA MLPs, and they are tracking that. And they have a two-page resource, like a quick fact sheet that came out of that convening. I'm sure we'll make that available today if you don't have it already. And then we also have a quick scan of the who, what, where, why, how of VA MLPs, showing the history of them. And then most importantly, we put a lot of energy into this readiness guide, which I will tell you about. There's a picture of it here. So a lot of work went into this readiness guide. This is the culmination of advice, best practices, regrets from VA MLPs across the country who have done the hard work of building and sustaining one of these programs. And in here you can find very basic how-to on things like designing your memorandum of understanding, so you have a written a document to guide your partnership, to some stories that might help you in your thinking about how to set one of these up. Or if you already have one, you will probably get some good ideas from around the country on how to make your VA MLP better. And this was reviewed by an expert panel that we put together. So I'd recommend that you check it out. We tried to make things simple in the guide, and this is just a cheat sheet that you'll find in the front of the guide with the top 10 things that you would need to know. And I'll just go through this briefly here just to give you some quick highlights because I think it's important when you're thinking about how to set up a VA MLP. And the first thing is that like any MLP, a VA MLP can be very flexible. So you can go in and say, I have these range of legal services and I'm going to help as many veterans as possible. And so you take a generalist approach. Or you can say, I'm going to look for a specific population or condition or a clinical team that's formed around one of these populations or conditions, and that's where I'm going to plug in. So for example, the Women Veterans Clinic, I'm going to go in there and I'm going to become an expert on issues specific to that population. So you can figure out what you want to do with it. There's flexibility there, which is valuable. You can pair it on top of a homeless patient aligned care team, which is, if you don't know this already, I heard David Rosenthal from Aurora aptly say that it's sort of the patient-centered medical home version at the VA. So these are integrated teams that are already in place that have social workers on them that you could plug into. I think one of the important things about the MLP model is that, yes, you are providing direct legal services, but the other piece of an MLP that's really important, and virtually all of them do this, is training. So going in and having some curricula for healthcare staff, both clinical and non-clinical, to say, here are what social determinants are, here are social determinants that often have legal underpinnings that we can help with, and here's how we can work together. And another part of the model that we virtually always see is this consultation piece. So you're helping patients directly, but you're also consulting with staff about how you can work together better to address the patient, and if there's even a role for the lawyer to help or not. I mentioned the VA directive, co-location, number 5, that is also a core element of MLP and that of the model, and that can range from 1 or 2 days a week to being there all the time, like a permanent staff member. And then I mentioned the importance of a team. You could go in there as a renegade lawyer, like I'm going to go and I'm going to, find my way in this organization. But we've heard time and time again that there are, from big to small issues, like getting your PIV card in order to get into the facility, or even finding the key to the room, that makes you learn very quickly that you need to have allies at your healthcare partner organization that are going to help you with problems big and small, and figure out how this thing is going to work. So when you do your MOU, and you can get guidance in the in the readiness guide, you do need to put that through the Office of General Counsel. There's instructions in there. We're going to talk about the SSVF program, and I'm sure you've already heard some of the funding challenges and opportunities that go into sustaining one of these MLPs. And then lastly, just to let you know, if you don't know this already, that if you are going to serve veterans and you are going to be assisting with VA benefits, I did not know this, but you do have to become accredited. And the guide gives you some links on how to do that. So let me just move on here and show you this, because you may want to know how the VA views these medical legal partnerships, and they actually came up with this. We did not come up with this at the National Center for MLP, but I think it's really nice because this is how they're tracking all of their VA MLPs. And clearly there's a planning process that progresses into becoming operational. When you have your MOU signed, you're starting to see clients to you being more mature and seeing a higher volume of clients and being on site more with ample staffing. This is a tool that many of you might have seen before, but we use it all the time in our work. We refer to it as iHelp because of the mnemonic on the side: income, housing, education and employment, legal status, and personal and family stability. And we've taken this tool and adapted it for veterans slightly. And this tool can be really useful in your education and training of staff at healthcare facilities, trying to teach someone all the ways in which a lawyer can help a patient is sometimes overwhelming. So this is like a nice guide to refer to, or a cheat sheet. I'm sure you all know who you are, so you probably don't need this, but I did want to do a quick footnote that a lot of medical legal partnerships, because of maybe issues with capacity or enough expertise, they actually partner with other legal partners, and sometimes across a variety of settings, in order to serve the same healthcare client. Sometimes there's just too many patients for one lawyer or one organization to help. And so that's a nice part of the model, I think. Funding, it sounds like you've heard about this. You're going to continue to hear about it. In surveys that we've done annually of medical legal partnerships, including of the VA, we know that by and large, MLPs draw on more than one source of funding to be able to sustain themselves. And several of them rely on philanthropy, and I think that's particularly true in the VA. We've heard of legal organizations leveraging the fact that they're working with veterans, and there are a number of funders out there that want to support work with veterans, and so they use that as an opportunity to support their work, and it is something that you have to make time for. You know, there are some people we've heard from that said, sometimes I feel like half my job is being a fundraiser just to make sure that we keep this alive and keep it going, because once you start your MLP, there's a reliance on it and you don't want it to go away. This is a quick simplification of, probably an oversimplification of the themes that come up in the guide if you're to read it. And I've covered a lot of this, but that the importance of going, you know, wide and deep when it comes to a lawyer forming relationships in the healthcare organization. That's really important, because a lot of times a new MLP lawyer will come in and they'll form a relationship with the social worker, and it's great, and that social worker is very helpful and gets them a number of referrals, but then that social worker goes away. And so you have to start all over again. So as many people in the organization that you can get to know, the more likely you will be to embed your services and get referrals from a variety of places. And the same is true with veterans, especially in a VA setting. Veterans are not just there to get their health care. They're getting a variety of things in these settings. And sometimes, you'll see the same patients there several times a week, but it's a community. So the more you can show your face there and your presence known, particularly when you're starting out, the better it is. And then I'll just give you a couple examples of starting off on the right foot. Again, you can find this in your guide. You're going to hear from Pine Tree on the next webinar, it sounds like. This is some of their work with the Maine VA. And what they did when they started out is they said, before we even get started, we want to ask all the staff at this VA healthcare facility, what is their knowledge of the legal issues facing their patients? How much do they know? And then we're going to tailor our training that we do with them. I think they did annual trainings with staff, but we're going to tailor that to what their knowledge base is. And you can look at their needs assessment in the guide. You can use it. You can steal it. They're okay with that. But you might ask, how did they get people to fill this out? And what they did is when you start a VA MLP, you have to get the support of your medical director at that facility to sign the MOU. And so when they did that, they asked the medical director, will you distribute this needs assessment? And so I like to say that when my boss or my boss's boss asks me to fill something out, you usually do it, and you do it pretty quickly. So you can imagine the response rate that they got. They got a lot of intel back, which was great. And then they also got the additional benefit of advertising their MLP services before they were even rolled out. So everyone in the organization knew about it, which was wonderful. And then they took things a step further, and they said, we need to be able to get information on how our MLP is working long term. We need to be able to continue to get information from primary care, from nursing, from behavioral health, all of the areas of the hospital that are sending us referrals, because we want to make sure that that works. If you're not getting referrals, you can't help anyone. So they set up this advisory council, and they made sure there was representation from each of the major departments in the hospital on that advisory council, and they would meet monthly. And those members would bring information from that meeting back to their departments. And then in a very lawyerly way, they knew that they might not get a continued commitment to this advisory council. So what they did is they put it in their MOU. They put it in writing that, that both partners would staff this advisory council, which I think was very smart. And I just wanted to close here. You can find some of these quotes, so you see here from New York, they have a number of legal clinics in addition to their MLP, so it was very active. And, having that there, they said it's a form of outreach in and of itself. And, I've had a lot of veterans come up and ask me about our services simply because they heard me calling for the next legal appointment in the waiting room. So don't underestimate your presence. And then a quote from West LA about their HPAC, that homeless patient care line team, that the importance of identifying the correct healthcare team for the MLP lawyer to partner with, which I talked about today. Another quote from Inner City Law Center, the importance of having a medical champion who can help establish a foundation. And then from Long Beach, the importance of building relationships with medical staff. And I think Radhika hit on this, or Casey rather, but we've seen this in a lot of MLPs, but particularly in the VA. And a lot of times we get questions about where do I even begin? This seems like maybe a needle in a haystack operation, because I know that there are a lot of potential clients out there or patients that have legal needs, but I don't know where to find them, and I don't know how to make sure that everyone is screening for these individuals so that I can find them. Or they've gone too broadly, and it's hard to really communicate what their services are because they're so wide-ranging. The idea of targeting, at least to begin, and finding a population or a team, there are great examples of that. You can read about that in the guide. But I think if I have one piece of advice, and the many MLPs I've talked to and visited, this is something that really came through. So I will stop there and hand it back over to Casey.
Great, thank you so much, Jen. So we have a question. Where can we get a copy of a generic MOU? This is for you, Jen.
Okay, so I think there are 2 MOUs in the Readiness Guide. I'm thinking that we actually have a generic one in our other we have another toolkit on our website. Could we send that out after the webinar, Casey? Is that possible? Okay.
All right. So that was so feel free to send the questions as we're going. That was we got one question while Jen was speaking. So if you have any more questions, feel free to just send them on over to me, and I will hold them until after Patrice, if they're for Patrice, or until the Q&A session. Moving along. So moving right along to SSBF. I'm trying to get this to you. All right. So moving into SSBF. So SSBF provides supportive services to very low-income veteran families to prevent veteran homelessness and rapidly rehouse veterans who become homeless. SSBF authorizes for legal services, and it can help with a wide range of legal issues. It cannot help with court-adjudicated judgments or fines, and it is also important to note that it can assist with discharge upgrades, and you can read more about that in the 2017 program guide. SSBF funds often go to a nonprofit like a United Way, and then that organization will subgrant to a legal services organization. This is often because SSBF requires case management services. So if a legal aid doesn't have the capacity to do that, or if serving veterans is not their #1 primary focus, it's often better and less heavy a lift for a legal aid organization to subgrant rather than be the direct grantee. You can learn more about SSBF in our previous webinar, which, as I previously mentioned, will be re-recorded on September 30th and then uploaded to both our YouTube channel and the NLADA webinar webpage shortly afterwards. So we have 4 delivery models for SSBF: in-house counsel, subcontract, which is the one that we most often recommend, which is either a flat fee or a fee for service. So a subcontract for a flat fee might look like buying X percentage of an attorney's time, and then a fee for service might look like buying X number of cases up to a certain number. We tend to recommend the flat fee because it allows for you to plan how many cases and how much time is spent on veterans-related cases. And then a legal service module looks like legal services being directly written into the grant. If you would like copies of MOUs and best practices, we can send you those if you just send us an email at resourcedesk@nlada.org. All right, so we are moving along, and Patrice will be our new presenter.
Hi, good afternoon. Can you hear me?
Yes, we can hear you great. Thank you.
Okay, great. Thank you so much for having me. My name is Patrice Paldino. I'm the Executive Director for Coast to Coast Legal Aid. Just as a background, I've been working with our SSVF project that I'm going to talk about for about 6 years now since it came to the area. And I was involved in establishing the program here in Broward County, Florida. So as you may know, and as Jennifer referenced and perhaps was on some previous webinars, veterans see a wide range of legal issues. Some things that I would just like to point out to you that we come in contact with, driver's license suspensions. We try and take a holistic approach to a veteran's issue. So if a veteran comes in because they're being evicted, which is a very common issue for veterans, we don't look at just that eviction. We look at what's the root cause, why are they being evicted? If the reason is that they don't have a driver's license, so they can't go to work, then we try and work on lifting the suspension on the driver's license. You'll see also on this list issues surrounding LGBTQ, gender markers, sexual identity. Those are really interesting issues when they come up, because as legal service providers, you know that you take your client with not just the problem that they're presenting, right? They never come in with just one issue. And you have to look at your client through the lens of being a veteran, let's say. So you're familiar with veterans' issues, the trauma that they go through, post-traumatic stress disorder, the social isolation. But if you have a veteran that comes to you that's also LGBT, you have to layer on that additional lens now, right? So now you're looking at your client through the veteran lens and the LGBT issue. You may have an elderly veteran, so now you have to layer on an elderly LGBT veteran, so you have to layer on the additional lens and consider all of those things and be aware that all of those things could be impacting his or her issue. So for example, the person who's coming in for an eviction that self-identifies as a woman but is biologically identified as a man may not be able to work because they don't have a driver's license, because they can't get a driver's license in the gender identity to which they identify. So you may have to help that person with a name change so that they can get the driver's license, so that they can get the job. So it's several layers of different things that you have to consider. When you have a senior that comes in, you may have to consider advanced directives, estate planning, or we're also right now applying for a grant to deal with victims of military sexual assault. So that may layer into and complicate the veterans' issues. Here in Broward County, Florida, if you're not familiar with Broward, we are basically Fort Lauderdale, Florida. We are north of Miami, south of Palm Beach County. We're a pretty diverse area in terms of socioeconomic status, gender, race, gender identity, HIV incidents. So it's a very transient population. We have 2 legal service providers in Broward County. We are both co-located in the same building. If you're familiar with Legal Services Corporation, the corporation for which I'm the executive director is Coast to Coast Legal Aid. We receive LSC funding. Our sister organization is Legal Aid of Broward. They do not receive LSC funding. And what we've done is that we have a shared board of directors, and we're co-located. And the 2 corporations work together to determine what the needs are, the legal needs are in the community. And we avoid duplication of services. So we complement one another. We seek grant opportunities together that would work. So for one example would be our housing projects. Coast to Coast receives Title III funding to represent elders. So because of that, we have funding to represent elderly people in housing issues for persons 60 and over. Legal aid serves persons 60 and under in housing issues. So when we were dividing how we were going to provide services to veterans, we kind of tried to stay on that same, how we traditionally separate our programs so that we can provide the most holistic approach, and that if somebody gets to our building, if a client gets here, it doesn't matter which program is going to serve them, somebody in the building is going to serve them. We provide services to veterans through several programs. Both Legal Aid and Coast to Coast receive SSVF funding through the United Way. One of the limitations of that is that while it's a tremendous opportunity to serve veterans, one of the things that we find is that because it's limited to actually homeless or on the verge of homelessness, sometimes that complicates an issue. So for example, somebody comes in here that needs benefits assistance. Benefits issues last a long time. Though applying for SSI or appealing a denial of SSI benefits can take a long time, and the caseworkers at United Way, they want to shut down those files a little bit faster. So sometimes if our client comes in and they were homeless at the time, so we take on a benefits issue and then the caseworker gets them housed, technically that person is no longer SSVF eligible because they're not at risk of homelessness or actually homeless. So that is a complication that we have found with the program. Also we've had, for example, the widow come in, or the children, the surviving children, minor children of a veteran, and those are issues that are not covered by SSVF. We have what we call our Valor Project. This is a project that is located at our VA center. We have Mission United, which is, I'm going to talk about more in a little bit. That is also funded by the United Way. And we also have OST, which is Operation Sacred Trust, which is the second SSVF provider here in Broward County that contracts with Legal Aid of Broward. So, you know this, the SSVF is funded by the Veterans Administration and comes down to the local communities and pretty much allows the community, the experts in the field, to determine how to establish their collaborative services. And I've listed here the different things that the collaboration for United Way of Broward includes: case management, legal, housing, employment, and so forth. They also have a great mentorship program for veterans through their Mission United project. But their Mission United project is amazing. We have this Mission United Pro Bono project. This is independently funded through the United Way. This is not SSVF funding. This money goes to Legal Aid Service of Broward County, our sister organization, to establish pro bono legal services for veterans. At this time, they have almost 400 attorneys in the community that have volunteered to take cases. And the way we handle these cases is that, as I said to you earlier, when Legal Aid and Coast to Coast sat down and were trying to determine how to best use the SSVF dollars in the most efficient way and stick with our historical division of services, we looked at what are the immediate needs, what are things that we can send to pro bono attorneys, and what are things that we cannot. Evictions are very difficult to place to pro bono attorneys because in Florida, at least, there's a 5-day answer period. So once the tenant is served with an eviction, there's only 5 days to respond. And if they don't respond, then they're automatically evicted. So we find that that's a difficult type of case to send to a pro bono attorney because there's just not enough time to find someone who's sitting at their desk waiting for an eviction to come in. So that's something that we said, okay, that's something that we need an SSVF attorney in-house to handle when someone walks in with a 3-day notice that they're behind in their rent or an eviction complaint, we need to jump on that. Other issues, though, we find are appropriate to send out to pro bono attorneys: foreclosures, credit card debts, garnishments, things that take a little bit longer time that we have experts in the field that we can rely on. And you can see here, just in 2018 and 19, they've done over 1,200 assessments, and they refer out. They have placed 115 cases and recorded over 4,000 hours of service. Here is a greater breakdown of the cases that we've sent out to pro bono attorneys so that you have an idea. See, these are things that, while we may do it in-house, like immigration, we do have an immigration unit. That immigration unit is limited in the services it can provide based on the grants that it receives, so we send these out to pro bono attorneys. And you can see what the highest needs are. Actually, I'm very surprised that housing is far down on the list, and even on there, because they're showing that as 16 non-foreclosure cases, and foreclosure pretty far down. Traditionally, housing is a pretty high need, but that number is skewed by the fact that we keep so many housing cases in-house. So this is just a breakdown of what I mentioned earlier, our traditional services, how we provide them to the community, and how we split them between the organizations. So Coast to Coast handles housing for persons under 60 as well as benefits issues, and Legal Aid of Broward handles housing issues for persons over 60. And again, this is based on how this community has defined it. This is something that you look at in your community and you determine what are the needs of the community and how can we best use the limited resources that we have to provide the most holistic approach. Oops, I'm sorry, hit the wrong one. This is another model to consider, because up until now I've told you so far that we have a pro bono component. We have 2 legal service providers with SSVF funding that have sat down together and collaborated about what's the best model, and that money comes through the United Way. Legal Aid Service of Broward gets money from Operation Sacred Trust. That is an SSVF provider. I'm not really exactly sure how they got funded also in Broward County, because they're primarily a Miami-Dade County provider, which is south of us. Somehow they were also able to get a little bit of funding in Broward, despite the fact that the United Way has such a large project here in Broward. They provide housing services weekly. So we have an attorney that goes out once a week, triages all of their cases. It's the same day that they do orientation for the veteran into the SSVF project. So the veteran goes from a general informational session to meeting with the attorney and triaging issues. And then that attorney either gives advice and counsel right on the spot, or will screen those cases to see what can be brought back to the office, either for representation in-house or through our pro bono program. So how do we get cases? Lots of different ways. We're definitely not at a loss for cases. We have in-house transfers. So our application, no matter what they're coming in for, it asks them, are you a veteran? If they are, we don't say, okay, well, now you have to fill out this different application. No, that they can fill out that same application, and in-house, we're going to route it to one of the various programs that we have, so that the client isn't disrupted in any way. Oh, now you have to go down the street or take a bus and go somewhere else. No, we'll figure out, and they don't have to ask, well, I want to speak to Patrice. They ask to speak to me, but they really have to talk to James. We'll figure all that out. You just fill out the application, you check off you're a veteran, and we're going to screen your issue appropriately. We are required by our SSVF contract to have those cases referred by case management. This has been a really sticky point. I'm not sure if this is news to any of you, but sometimes attorneys are not welcomed into collaborations. We're viewed with a little bit of reluctance about why you need to be involved, why are you taking our money, we could be using it for case management, because there isn't a full understanding of the benefit that attorneys can provide. So one of my best pieces of advice is to make sure that you have your elevator speech or your 5-minute presentation on what the importance of having legal services means. And I'll show you a little bit towards the end. But there is a general reluctance to having it. I actually had one provider ask me, why are you taking our money? So, you know, you do have that hurdle that you have to get over. Case managers have a very limited understanding of legal services. So we provide them with what we call a legal checkup, which is a list of things that they can ask their clients or their veterans, because sometimes what they'll ask is, do you need any legal assistance? Well, no, I haven't been arrested, so I don't know that I have a legal issue, but meanwhile, you know, I have 3. There is a very high turnover with case management. It's a difficult job. It's an underpaid and thankless job. So there is a high turnover. And we find, as Jen said, one of the best things that we do is to provide continuing education to case management so that they're not providing legal advice and practicing law without a license, that they are at least able to recognize, hey, this person has a legal issue, I need to call an attorney or refer them to an attorney. We do outreach. We go to various centers. We incorporate our veteran outreach into any outreach that we're doing. So we're doing a general outreach for the public. We also make sure that we mention that we have specific veteran services. And as I mentioned earlier, we have an attorney who goes out to our local VA. And another thing that I have found to be a tremendous tool is that we have applied for rent assistance grants. So if you're familiar with SSVF, there is funding available through SSVF to pay the rent for a veteran who's at risk of homelessness, or to move a veteran into a home if the veteran is actually homeless, which is amazing. What we've done here, however, is look for other partners throughout the country who would be willing to provide us with rent assistance money. So when I have a veteran sitting in my office and they're $1,000 behind in their rent, we have programs, we have the ability to write the check. So that veteran's $1,000 behind, you call up the landlord and you say, listen, the person is eligible for SSVF funding, they'll have the $1,000. Well, today is September 24th, and they're already $1,000 behind. October 1st is next week. That landlord knows that some rent assistance programs take 4 weeks to cut a check. Well, how do I know I'm going to get paid on October 1st? How do I know I'm going to get paid on November 1st? What I have done is say, listen, I will cut you a check today for $1,000 and hand it to you today. You can come to my office and pick it up. I will bring it to you. I can put it in an overnight package to you. Tell me how you want me to deliver it, and I'll be happy to if you stop this eviction. If you sign an agreement that's a stipulation that you will stop the eviction. And that is a tremendous power to have, because the more rent assistance programs are popular but also underfunded, landlords know the difficulties with having to deal with a rent assistance program. So we've actually gotten dollars here so that we can cut the check and get to it quickly. We also have a family law attorney in-house, which is somebody that is funded through Mission United's general program, obviously not through SSVF, because the family law is busting with cases. We cannot possibly place all of the family law cases for veterans, which again goes back to, we looked at in this community, what do we have the ability to do and where do we need to bring it in-house? We do also pro bono family law cases, but they go through those cases and determine which ones are urgent and need to be addressed immediately. So contracts are a nightmare. We've gone through a couple different models over the last 6 or 7 years. We have what I would prefer, a per case type of contract, which is actually what I'm trying to accomplish as we move forward. You have to make sure, though, that when you look at a per case contract, you have to look at what's the average time that you spend on a case. So what I did is I looked at all of our cases in a year, found an average of how much time we give to clients, and then I also did the same thing for the veterans in that same year. And generally, we are providing 7 to 8 hours of service per client. So I use that not as an official method, but that makes sense to me. We're providing about 7 hours. So what does 7 hours of our time cost? What is it that I want to recoup for 7 hours of one of my attorney's time? And that's how I move from there to determining, well, if they're going to pay me on a per hour basis, this is the number that I'm looking at. If they're going to pay me on a per case basis, well, then that per case number has to reflect that some cases take 26 hours and some cases only take 2 hours. So you're going to lose money on the 26-hour case, but you're going to be making money on the 2-hour case. And again, that is something that you have to look at your numbers and your statistics and determine how is it that you're going to come up with that number. For the FTE, I'm really not a fan of the FTE contract, and here's why. The funder owns your staff, right? You have a full-time attorney dedicated to veterans. They can't do anything else, which is fine because you want them only serving veterans, but they're locked into that contract. So they can only work on United Way cases that come through case management. So if I identify a veteran that comes through the front door, I can't bill for that person under SSVF until I first send them to SSVF, get them enrolled, get them back in my door. And if it's something like an eviction that's moving very quickly, they come in the door, let me tell you, we're going to stop what we're doing and help them, but that's time that I can't bill because they haven't yet enrolled. So while my attorney is dedicated to veterans issues, I'm not necessarily paid for everything that they're doing, and I can't bill the funder for that. So I'm not a big fan of FTEs. I think it might work in some situations where you know that that you're going to have some other system of getting them enrolled, but our provider, they have to be enrolled in order for us to talk to them and bill for it. So I'm not a fan of that. Or for some reason they come in and they're not, they come in through our front door and we say, okay, we need you to enroll in SSVF. They go and they try and enroll in SSVF, and for some reason they're deemed ineligible for SSVF. We're still going to help them, right? But we can't bill SSVF for that. So, and I can't use that staff person on that case. Our current contract is kind of a hybrid of what I've just talked about. It has a requirement that we serve 108 unduplicated clients, which is very easy to do. It becomes problematic because carryover numbers don't count. So that SSI client that I said that takes 2 years to resolve their SSI appeal does not count if I started the case last fiscal year. It does not carry over to the next year. So I'm still working that case. My attorney is still working that case, but now I have to add another 108 cases in the following fiscal year. The contract provides an hourly rate and dollar cap that we're not supposed to exceed, but also requires us to bill hourly by the quarter hour and meet that 108 unduplicated number. And we can't exceed those. If we do, I mean, great if we do for them because we're serving the clients, but we can't bill for more than 108 unduplicated clients or the cap on the dollar amount or the cap on the hourly amount. So if we were to reach our goal of 108 clients by June or May, which is pretty common, but the fiscal year doesn't end until September 30th, you're left in a position of deciding, well, do I say if Mission United sends me someone, we're not going to serve anyone else? No, of course not. Well, then you continue to serve and you're not getting paid for that. And so that determination that you made 2 steps ago about how much your attorney's time is worth on a per case or per hour basis has just been depreciated because you're now increasing the number of persons that you're serving. So you're increasing the cases, which means you're getting less per case, or you're increasing the number of hours that you're providing, which means your hourly rate has just gone down. It does also require that we enter data into their programs. So their program is called SAMIS, and also we have to be inside of HMIS, which is the Nationwide Homeless Service. So it does also slow us down a little bit because my attorneys are also entering time in our legal service database. The contract does cover 1 full-time attorney and 1 full-time paralegal as well as part of the supervisor. And that, again, is something, a determination that your office has to make based on how much you're providing and what gaps in service and funding you have. This is a great study. I would suggest the link is there. That back to the point I was saying earlier about making the pitch about why it's so important for attorneys to be involved. The Florida Bar Foundation did a study in 2015 of legal service providers. And what they found is that for every dollar that is spent on legal services, there is a $7 cost savings to the system in its entirety. That means that homeless shelters, emergency rooms, case management, all see a direct impact, a $7 return on the dollar that is invested in legal services. That's really powerful information. I've cited this study in grant applications over and over again. It resulted in $600 million in savings, and here's a breakdown of what the Bar Foundation found of additional benefits to the community. SSI, child support, I mean, you can read all that, but food stamps, emergency shelter, things like that. Domestic violence costs. Here are some more, just some interesting statistics is that in that year, they looked at over 83,000 cases and the issues that directly impact our clients. Also, the cost reduction to the burden on the courts of providing attorneys. Pro se litigants are not cost effective for the court system and very frustrating to judges. One other thing, just before I wrap up, I just wanted to mention an additional challenge that I neglected to put on the slide, but the attorney-client privilege. Just because you are funded through an SSVF partnership doesn't mean that your attorney-client obligations are waived in any way. And so you have to be careful in your contract negotiations. You have to watch for paragraphs that say that the funder could come and look at the files at any time they want, that you have to provide a list of all of the clients that you're serving. Some of the things that we've done is put in an addendum that says, well, yes, you're entitled to this information except for attorney-client privileged information. We've provided lists by file number as opposed to client name. We've also developed a waiver form to ask a client if they're willing to provide their name so that we can provide it to the SSVF case manager. But if your client isn't willing to sign that, then you cannot hand over that information. And the funder is very frustrated by that, and case management is extremely frustrated by the attorney-client privilege. They don't understand why they can't call you and ask you for information about the case. They sent you the case, they're working with the client, but I'm doing this and I'm doing that and I need to know. And you just have to make sure that you explain to them in a professional way so that they understand you're not trying to impede their information, that this is not your information to provide, that if the client allows you to provide that information, you're okay with that, but just because somebody's providing you with funding doesn't mean that it's an open door to your privilege. And you really need to check your state bar rules because every state bar is different. Florida has a very strict policy. I cannot even tell someone outside this office that Jane Doe is a client or is not a client or even sought our services. That is completely protected, and as I understand, some states aren't as strict, so it depends on your state. So it's a very difficult situation in the contract negotiations, but it is something that you need to be aware of. And with that, I will hand it back to the NLADA.
All right, thank you so much, Patrice, for that very detailed and in-depth look at your SSCF work and partnership. So moving on to the Q&A. If you have a question that you would like to ask, please send it on over in the question box, which is in the bottom right side of your screen. So starting off, where can we find the NLADA Policy Scan resource? So you can find this on the National Center for Medical Legal Partnerships website. You can also reach out to us at resourcedesk@nlada.org, and we will send that on over to you. Several others have asked if they could get a copy of the other National Center's Toolkit for Veterans. Yes, you can. We will upload that. We'll link it to our regular NLADA webinar webpage. It'll be at the bottom in selected resources, so all of these can be right there for you. And then we have another question. We are a 501c3 nonprofit. Can you help us get additional funding? Yes, we can. If you send us an email to resourcedesk@nlada.org and include any more information you have about whether or not you want to serve a special population like veterans or run a special project, maybe on housing or on substance abuse, feel free to send us an email. We can connect you with some resources that we and our partners have. And then, so those were all of the questions that we've gotten. So please, if you have any other questions, please send them. I know I want to ask one to Jen. So Radhika and I have gotten a few questions and requests from different law school clinics about what law school partnerships in MLPs might look like. So I was wondering if you could speak a little bit more about how law school clinics can partner with health centers or VA medical centers, and how they might be different or similar to how a civil legal aid organization might partner with them.
Yeah. So what I do know about how those partnerships work a little differently is mainly from our surveys and our research perspective. So, one nice thing about law school partnerships is that it seems, at least from our data, that they tend to be more resourced than other organizations, which is really nice. And then, they're well known in the community from a university standpoint. But I think one of the downsides certainly is the turnover with students. I think one of the things that we see happen with medical legal partnerships is that the lawyers form real relationships with the healthcare staff and patients, and they get to know them, and that's part of that secret sauce that goes into the success of this and making it part of this interdisciplinary team. And so that's one of the drawbacks from a law school perspective. In terms of examples, I'm sure we have a number of case studies on ncmlp.org. And I'm trying to think of some specifically. I don't know offhand for VA, what that breakdown looks like, how many are drawing on law schools, but maybe as a follow-up to this call, I could look for some case studies so that you can get a feel for how those partnerships manage, you know, both their assets and then any drawbacks to look out for, things to be mindful of. So sorry, that's probably not a great summary, but that I'm certain that others at NCMLP have developed some resources around this, and we'd be happy to share.
Great, great. That's very helpful. Thank you. So we have two more questions. These both are directed for Patrice. So Patrice, you mentioned something about rent assistance grants other than SSVF. What are some of those programs our organization could really benefit from that?
Hi, am I back?
Yes, you are back.
So we applied to a bank that had a veteran-specific focus. It was actually Wells Fargo. They loved our program. They funded it a couple times. We also have a similar program with our HIV clients through some AIDS organizations. So you have to be creative, right? I mean, legal services are traditionally not things that funders provide funding for, especially banks. They're not big fans of ours. But you have to look at, for example, Home Depot. Home Depot is one of the organizations that has a very veteran-focused foundation. Look for foundations, corporate foundations that are giving money for veteran services, and create your model to fit their priorities. And that's how we've done it. And they get great publicity for it, right? I mean, that's what a large funder is looking for, is what is it going to do for their organization? How is it going to make them look? Their logo on your website and in your materials and your advertising and on your websites and Facebook pages, that's what they're looking for. That's the return they're looking for.
Great, thank you. And then we have another question. The SSVF funds in my organization's counties currently go to 2 grantees who provide, among other things, housing and shelter services. Any suggestions on how to reach out and broach the topic of why adding legal services is worth them shifting money?
Yeah, that is a difficult sell. We were in the ground floor of the SSVF program, but we had that same problem with our HIV program, because I created this same model for persons living with AIDS, and that was already an established program, and everybody was getting their funding, and that's where someone said to me, why are you coming to try and take our money? Because the money was already divided, and why are you trying to get a piece of it? Because every piece that you get is less that my organization is going to get. So you have to look at the data. I think you have to use that research and show that the dollars make sense. You have to explain to non-lawyers what they're getting for their money. So, for example, one of the things I tell funders is, in Florida, it's a felony to practice law without a license. So if you don't care anything about your clients, because you could give them bad advice because you don't know what you're talking about, care about yourself, you don't want to have fines and fees and penalties, and also get sued by the client that you gave the wrong advice to and they lost their house in foreclosure. You know, generally, they're not in the business because they don't care. They do care. So when you explain to them, this is the service that I can provide, and do it in a respectful way, you know, that you're aware that you're cutting into their business. But on the other side of it, one of the conversations I've had with social workers is, listen, you're calling landlords. You shouldn't be calling landlords to negotiate an eviction. You have enough work to do. You're busy enough, and your job is difficult enough. I give them the respect because I believe that they do have enough work to do. Let me take this off your plate. If you let me do the legal work, you can focus on the social work. And that has been effective as well because they see the validity in that. They're overworked. They don't need to be doing a lawyer's job too. So you have to finesse is really what it comes down to.
Great, thank you. So that's it for questions. Does anyone, last call for questions, does anyone have any final questions, thoughts, things they want answered? All right, so before you go, I have a slide here. So NLADA and the Justice in Government Project, which is a project located in the Justice Programs Office at American University, has a survey.
Casey?
Yes.
Casey? Yeah, we can't see the slide because Patrice is still the presenter.
Oh, okay. Give me 1 second.
There you go.
All right, great. So we have a survey that asks about how technical assistance and trainings like this webinar, like our annual conference, have helped you in identifying funding sources, applying, and then hopefully successfully receiving. So if you would be ever so kind and fill out our survey, I've put the link here. It's both linked and you can also type it in because it's a short one. We would greatly appreciate it. We also, with the Justice in Government Project, have a monthly research newsletter where we pick topics. So for instance, last month was veterans, and we go through the research, we pull the important points, we help you identify the funding, and it comes to your inbox once a month. We won't spam you. You can see last month's newsletter at the link below, tinyurl.com/justvets. Our upcoming one in October will be opioids. Feel free to sign up. It is, we have been told, it is a very valuable resource. And then I've also put the resource desk email address at the bottom here for you. So if you are seeking individualized technical assistance, have any questions, want to see some sample MOUs from SSVF partnerships, feel free to reach out to us and we can send you those. Thank you everyone for attending, and thank you so much, Jen and Patrice, for joining our webinar and sharing with us information about your VA Readiness Guide and your SSVF partnership. If you want to contact any of us individually, you can find our email addresses and contact information on the second slide. We will be uploading the PowerPoint and the recorded webinar both to the NLADA's webinar webpage, and the recorded webinar will also be available on our YouTube channel. And all of the resources that we've spoken about today will also be linked in the bottom of the NLADA webinar webpage's site. So thank you very much.
Thank you.